What can people do to protect themselves and others from getting the new coronavirus? Stay aware of the latest information in the COVID-19 outbreak, available on the WHO website and through your national and local public health authority. Most people who become infected experience mild illness and recover, but it can be more severe for others. Take care of your health and protect others by doing the following. This virus called nCoV 2019. It's new and we're still learning about it. There is currently no vaccine to prevent it, but the best way to prevent illness is to avoid being exposed to this virus. From what we know, it can make some people a little sick with a slight runny nose. Other people get sicker and can have difficulty breathing and develop pneumonia. Some people get very sick and need to be hospitalized. Among those, unfortunately, some have died. While we still need to learn more about how the disease affects people, thus far most of those that died had other underlying health issues. There are several measures you can adopt to protect yourself and others from getting the new coronavirus. General protection measures for all people. Wash your hands frequently, regularly, and thoroughly. Wash your hands often with soap and water for at least 20 seconds, or clean them by using an alcohol-based hand rub product that contain at least 60% alcohol like gel, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Avoid touching eyes, nose, and mouth. Why? Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth. From there, the virus can enter your body and can make you sick. Clean and disinfect frequently touched surfaces daily, which includes tables, light switches, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them using detergent or soap and water barrier disinfection. Practice respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Droplets spread virus. They can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. By following good respiratory hygiene, you protect the people around you from viruses such as cold, flu, and COVID-19. Maintain social distancing. The virus is thought to spread mainly from person to person between people who are in close contact with one another, within about 6 feet, and through respiratory droplets produced when an infected person coughs or sneezes. Avoid close contact with anyone that has fever and cough. Maintain at least 1 meter distance between yourself and anyone who's coughing or sneezing. Avoid shaking hands, hugging, or kissing with these symptoms. Practical ways for greetings nowadays. If you need to take care of a person that suffers from fever, cough, and difficult breathing, don't forget to wear a mask, and in particular to practice hand hygiene. If you have fever, cough, and difficulty breathing, Seek medical care early and share information about any recent travels with your healthcare provider. If you just have mild respiratory symptoms and no specific travel history, carefully follow the precautions mentioned previously and make sure you stay home until recovery. Follow the directions of your local health authority. National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will also protect you and help you prevent spread of viruses and other infections. Follow the guidance outlined above. Stay at home if you begin to feel unwell, even with mild symptoms such as headache and a slight runny nose, until you recover. Avoiding contact with others and visits to medical facilities will allow these facilities to operate more effectively and help protect you and others from possible COVID-19 and other viruses. Can masks protect against infection of the new coronavirus? Medical masks like this one cannot protect against the new coronavirus when used alone. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you don't have these symptoms, you don't have to wear a mask because there is no evidence that they protect people who are not sick. However, if you are healthy but you are taking care of a person who may be infected with the new coronavirus, then you should wear a mask whenever you are in the same room with that person. These masks may be in short supply, and they should be saved for caregivers. And remember, if you choose to wear a mask, use it and discard it properly, and clean your hands with alcohol hand rub or soap and water. This information will change as we learn more about this disease. We will continue to provide updates as more information becomes available. If you need more information on the new coronavirus, check the WHO website at who.int.